Hey everyone, it's Dr. Charlotte Hodges, and I am just about to go pick up little Margie Ruth, and I want to talk a little bit today about the COVID-19. And no, I'm not talking about the coronavirus. I'm talking about the 19 pounds that you gained while you were on quarantine. I cannot tell you guys how many times, whenever I've been speaking with my patients over the last several weeks, that they've been clearly having a lot more stress, and they're struggling more with their diet. And I've been telling them, if you are actually able to at least just maintain your weight, then you are ahead of the game. But unfortunately, many people are starting to gain some weight, even when they're not so far out from surgery. And it's not that their hunger is really coming back, but it's just this immense stressful period that our lives have just been turned around. You know, I went for a walk today and I took a shower. I've put on my shorts, and oh my goodness, these are my shorts from last summer and they're a little tight. And I too have gained some weight over the last several weeks. And so this is what my challenge is for you. One of the things that I do whenever a patient is around the 9-month mark after surgery, or the 12-month mark, or whenever I'm working with my medical weight loss patients, one of the first things I like to do is test their metabolism. And I believe I've spoken about this before. One of the things that I do in my office is I use indirect calorimetry, and I use the review machine so I can get a pretty accurate measure of my patient's VO2 max, or their metabolism. But a way that you can kind of guesstimate that is with the Miflin St Jeor equation. And I'll have a link to this at the bottom of this post. This is a good way that I can kind of thumbnail or guesstimate where your calories need to be for you to maintain your weight. This is your BMR, or your basal metabolic rate. Now, I'm short, I'm in my mid-40s, and I don't weigh as much as I used to. And what's interesting is my basal metabolic rate is 1087. Yes, that is right. It means for me to maintain my weight, I only need 1,087 calories a day. That is not a lot. So if I'm trying to get in shape, I need to be netting below that consistently every day. Now, I myself am never going to eat less than 1,000 calories a day, and I really would never recommend that to one of my patients either. I know that there's some diet plans that are out there, and they're specifically called a very low calorie diet, where the calories are usually around 700 or 800 a day. I personally prefer to put patients on 1,000 calorie diet. That's about as low as I'll go. But for me personally, because I know my BMR is so low, I know the only way for me to get a significant calorie deficit is for me to do some exercise. And I've spoken about this before. My exercise of choice is certainly walking. And so this is my challenge to you guys today. Number one, put on that pair of shorts from last year, or that old pair of pants, or you've been losing weight and now you've kind of plateaued, and use this now as your starting point. Don't look back, just look forward. I encourage you, go online and check out the Miflin St Jeor equation and see exactly where your metabolic rate is. And then you really need to subtract 300 to 500 calories from that every day to start seeing some meaning results in your weight loss. I recommend that you start a food journal. Berrytastic is a fantastic app. I'll have a link to that. And MyFitnessPal is also a really great app. The walking app that I use is called Strava. And if you're a biker, I'm not a biker, but my husband is, or if you're a swimmer, oh my goodness, I do a great doggy paddle. I'm a terrible swimmer. However, that's a really good app that you can use if you either bike, walk, or swim. And it does a great job of measuring your distance, your time, as well as the calories burned based on your times. And I actually think it's much more accurate, certainly for walking, as opposed to just counting your steps. And I'm actually able to link my Strava to my MyFitnessPal. So I think for everyone, whether you've had surgery, if you haven't, if you just know someone that's starting to struggle with their weight, or you're starting to see that you're starting to get that COVID-19, check out your BMR, write down your food log, and make a game plan. And don't just say, oh, I think I'm going to. I want you to have plan A, plan B, and then initiate it. And guess what? It's totally fine if one day you have a maintenance day. The next day you can start again. The main thing is don't go into a surplus. If you fall off the wagon, let that day be a maintenance day, and then that way every day after that, get into your calorie deficit. So I hope that this helps you guys know that the struggle is real. Everybody is feeling the pinch from this quarantine. Everybody, please stay safe. Mind social distancing. Follow the laws of the land or of the city and county that you're in, and know that this too shall pass. All right, I hope that this helps. Please share this with your friend, and don't forget to subscribe. Oh, and give me a like too. Bye.